Actually, they're extremely rare. They're even more rare than you would think. The way that I do it, which is a true awake rhinoplasty, meaning I give patients medication, but they can still talk to me, they're awake, and it's safe. That's an awake rhinoplasty, but extremely rare, and I'll get to why. But then a lot are trying to market awake by putting people under IV sedation or twilight. That's the one that's getting a bad rep for not being safe because you worry about airway and aspiration. I do not call that awake. That is not awake. You're asleep. It's twilight. It's IV sedation. That is not awake. But why awake is, like true awake is rare, is because I think a lot of times surgeons really don't want to deal with the patient. As surgeons, we are trained to just go in, operate, do everything. For me, it was a very natural transition because in my training, I did a lot of awake things. We did a lot of call at the hospitals. We repaired a lot of dog bites and injuries, especially for little kids. So I was very used to working on the awake patient. Coming from, facial plastics, ENT started doing a lot of balloon sinuplasty. We're actually cracking open the bones of the face, and we were doing these awake, and I got very good at that. So that was just a very natural transition for me, and I said, why can I not do this awake? It's the same concept, and we can keep patients comfortable. I've talked to many doctors. They've asked me about my technique, my protocol for it, and when I describe it, they just go, oh no, I don't want them awake. So I think that they're just not comfortable having their patients awake. Rhinoplasty is an extremely difficult procedure, and it has to be done very carefully, very meticulously. Again, something that was a natural transition for me was I've always been very meticulous, very careful. Not that others aren't. Sometimes their surgical, actually technique and practice may be a little bit more rough, and they don't want to worry about the patient being there and witnessing it or seeing them struggle with the actual surgery. So I think those are really the big issues that kind of lead to this. But it's just been something that for me, I feel very comfortable doing it. Obviously, I've done this for many years and very many times. And if I can offer that to my patients, I'm glad to be able to give it to them.